That was awesome. I learned a lot. Thank you so much. My name is Christopher Coburn. Everybody, I use he and him pronouns. I'm not a scientist, so I won't have any graphs and data in that way. But I really enjoy getting to share the space with scientists because I always learn a lot. As I said, my name is Christopher. I'm going to spend just a quick few minutes talking more specifically about our COVID-19 response in Gallatin County. I'm going to do that through the lens of the ways in which I serve this community, which is in a few ways. I sit on the Gallatin City County Board of Health. I'll talk a little bit more about that in a moment here. I also sit on the Gallatin COVID-19 Vaccine Distribution Task Force. Talk about that in a moment here too. In my day job, I used to work at Bozeman Health, and I serve as the system manager for health improvement and partnerships. So I spend a lot of time working with our community partners on efforts to improve community health. And during the COVID-19 pandemic, I had a brief stint early on in the pandemic. We're still in it, but early on in the pandemic, I served for the health system as the public information officer, which was we probably could have used those communication strategies early on to help people understand what it is that we were talking about, what we were doing. But I served in that way as well. Before we kind of get into a few minutes, I just want to ground ourselves in the fact that the community where I get to serve, Gallatin County, is really the traditional and ancestral homelands of many peoples, including the Cheyenne, Salish, Kootenai, and Crow peoples who continue to caretake this land as they have done for generations. And it's on this indigenous ancestral land in which we've seen this top row ring true for our experience of the COVID-19 pandemic. So in our county, in Gallatin County, we've had over 50 people who have died as a result of COVID-19 or SARS-CoV-2. We've had over 40 people who have been hospitalized. We've had over 12,000 people who've tested positive for COVID-19, and this is data as of a couple days ago. So I think it's pretty similar. It could be a little bit different now. So that's the experience that we've had in this county throughout this year-long pandemic. Our response to that has been, I think, pretty powerful, and has looked like we've locally adopted, passed, and enforced at least 10 is being really conservative because there's been a lot of changes to some of these policies, but at least 10 local health policies and rules that have been designed to keep our community, keep each other and ourselves safe. To date, we've administered just about 18,000 vaccine doses to people in our communities, and we've over 5,000 people have completed their vaccine doses, so getting those 2 shots. This is pretty comparable to what we're seeing across the state. Some other counties have more people vaccinated than we do, and that is a product of the way that the state allocates vaccine doses and how many hospitals are in each community. But we're seeing a really strong effort in Montana is really leading the nation in being able to utilize all their vaccine doses that they're getting. We have a really strong record of not wasting any vaccine doses and really getting them into people pretty quickly, and I think pretty effectively. So just to kind of talk about the response a little bit more, I want to talk a little bit about my role on the City County Board of Health, because I think we've heard a lot about the Board of Health. Actually, I know we have heard a lot about the Board of Health over the past year, and I don't know if everyone knows exactly what it is. So the way that public health operates in the state of Montana is through these decentralized boards of health and health departments. So there is a sort of state agency that Seth talked about, DPHHS, but the local decisions are made by local health departments who are overseen by and run by local county or local city county boards of health. And those boards of health are comprised of appointed people who are appointed by the appropriate commission or council body. So in our county, we have half of our board is appointed by the county commission and half is appointed by the Bozeman City Commission. So that's kind of how our board is structured, and we are mandated by state code to protect the public health in a whole host of ways, including from the threat and spread of communicable diseases. So it's not something that we can do or might do. It's something that we have to do, that we shall do, and that is written in the code, which is put on there for you in case you're interested in the Montana Code annotated. So as a board, we really have a lot of responsibility. During the pandemic, it's been really focused on adopting and enacting local health rules and directives, rooted in science, rooted in evidence, and rooted in the best available information to protect people. And those have looked like restricting and closing certain types of establishments to limit the amount of time people are spending together. It's looked like enacting a mandate to wear masks when you're out in public. It's looked like instituting closing times or restrictions on who can see people in certain settings, and enforcing isolation and quarantine measures, which was like the bedrock of public health protective policy. To make those local health policies work and to kind of adopt them and to even create them, I think Seth talks a little bit about how public health is, we've learned and we continue to learn to be more effective at balancing all the different things we need to be considering that people are experiencing. So it's not just about, protecting people from COVID-19. It is about that, but it's also about thinking about the other things that people need to live their lives in healthy and protective ways. So balancing all those different interests and needs that people have to create policies that are actually going to keep people safe and have a likelihood of being followed with minimal enforcement. And then we also have a big responsibility of engaging with the public. I think the Board of Health and, by extension, the Health Department have become and have been seen recently as, the leading source of information. And we really want that because it's the entire job to know the entire public health situation that we're experiencing and being able to communicate that effectively. So that's something that the board is really focused on as well. Speaking more about our vaccine distribution efforts so far, we get a lot of questions about how things are going and why they're going the way they are. And I think I want to just spend a little bit of time talking about where we're at, how we've gotten to this point of having over 5,000 people in our county fully vaccinated. So we're following an approach that's led by the state, which is grouping people into different risk phases. So phase 1A, 1B, 1C, and then 2. And this is subject to change depending on who's in the governor's mansion. And we did see that shift happen when Governor Gianforte took office. We saw a shift from the previous phases and who was in those to the current phases. And that's a challenge in public health because we are, so beholden to those policies, and we want to be in lockstep in many ways with the state and with what other counties are doing. But what that has meant and has had real implications for our county and for our state, the switching in phases has meant that teachers and other essential workers were shifted from phase 1B to phase 1C, which has a whole host of communication challenges and also just a whole bunch of community challenges when you move people around like that. But we're following the state guidance in terms of how we're allocating vaccines. To do this effectively, there is an immense amount of coordination happening between every entity that provides vaccines and every entity that really works with people or consumers or customers, which is basically everybody, because people have questions about this. So there's a lot of collaboration to make sure that we're being as effective as possible. In our county and in our state, we're have this intentional focus on being equitable as possible, knowing that the COVID-19 pandemic has been disproportionately felt by certain parts of our population, including American Indians and people of color. So making sure that we're prioritizing folks to get immunized who have shouldered the burden of this pandemic, and also being intentional about how we reach out to hard to reach population, people who don't like to use technology or can't use technology, who don't have transportation, who maybe speak languages other than English. So being really intentional about how we're doing that. And I think underpinning all this is there's really sort of broad and important challenges that we have that make it harder for us to be as effective as we want to be. The biggest one being supply. We simply don't have enough supply to provide vaccines to everybody who wants one right now. So the supply is by far our biggest limiting factor, followed closely by storage. I think it was Matt who talked a little bit about storage, but it is really hard for us to get vaccines out to people in non-healthcare settings if they have really sort of strict and sort of hard to achieve storage requirements. That's something that we're dealing with too. Liz talks a little bit about hesitancy, and we're seeing that as being a challenge too. It's not so much right now because we don't have enough supply, but I think as our supply catches up, we're going to have to really combat in our state these communication channels. So how do we get people to move from being unsure to being excited about COVID-19 vaccinations? And then we have this situation where, in our country, it's no secret that we do not have a very well-coordinated public health system across our entire country. So trying to do a mass vaccination in this speed and to this scale is really challenging because we don't have that public health system in place like many other countries do. And the last thing I'll say is, as we look forward, as we continue to move through this pandemic, there's a few things I hope that everybody continues to do. One is this continuation of keeping a focus of keeping yourself and the people you care about in your community safe. And that looks like continuing to maintain hand hygiene, mask wearing, keeping, social distance from people, and also getting vaccinated when it's your turn to do so. Advocating for public health with your elected officials. Public health, mind-blowingly to me, is under attack at every level in the state. And so it's really important that people who care about these public health policies feel empowered to advocate for them and use their voices to say, no, we actually do want systems that are going to protect us. And then finally, I think, and probably most importantly, is continue to practice patience and kindness. We're all experiencing this pandemic very differently. There's certainly a lot of commonalities, but I found, and what we've seen throughout the response to this pandemic, is really that kindness goes a long way, and that patience sort of keep it going will really serve us well as we continue to move through this pandemic and hopefully get to an end in the not too distant future. And that